Okay, hi, I'm Jessica and I'm doing my ABG checkoff. So here we are in the patient's room. I'm going to walk in and let them know my name. My name's Jessica from respiratory. Here to draw blood for oxygen levels in your blood. Kind of explains different from a normal blood draw from a vein. It's from your artery. Most people understand that arteries have the oxygen away from your heart. And veins bring it back, so they'll kind of understand that you're doing an artery, and that's different. Check the patient's chart. Look for red flags like blood thinners or any kind of like artery problem, vascular problems, because that might hinder getting blood. Make sure that you have the doctor's orders correct. Make sure it's the correct patient, and check the lab to see how much they want you to draw. We're going to open up our kit and get our kit. We're going to open up, get everything set up. Over here, so I already did that for some reason. Open your kit, right? Here we go. Open. There you get your needle, your syringe, and here's your bag. It's a cool biohazard bag. Hazard. Here we go. Do you want to hold it for me? No, it's just my pumper. Lid and red corky thing, and then here's your label, which you're going to fill out before. Okay, so fill it out. There you go. Here is alcohol. Open that up so we can get to it when we need it. And here is Band-Aid. Just going to also open that up so we can get to it when we need it. And gauze, which you're going to put right here for now. Okay, so that's all our stuff. And the first thing you want to do is do an Allen test, which is to ensure that they have proper blood flow. Now you get a pump, sweetie. Okay, ready? So pump. Okay, so then you want to find their radial artery, which is on the thumb side. It's radial. On the radius, so pump. Good. So find the artery, and then with your other hand, you're going to try to locate the ulnar, which you can't really feel because it's like down deep, but it's kind of in the same spot in the other groove, if you will. Pump, pump, pump. Keep going. Keep going. Pump, 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 pump. Oh, God, she broke it. Okay, well, so what you're going to do is you're going to push down and occlude both arteries with pressure. And then you're going to ask the patient to clench their fist and then unclench it about 3 times or so until you see their palm turn white. Right, and then you're going to keep the pressure on the radial side and release the ulnar side. You're going to watch their palm. It's going to turn pink within 3 to 5 seconds, up to 10 is okay. And that just ensures that they have proper blood flow, because you have the brachial, right, and it splits here and it goes down into the radial, and then actually curves and arch and comes back to the ulnar.
Is that enough pumping?
That's perfect. You're good. So if this is occluded, you can still get it from here, so it just shows they have good blood flow. So after they pass the test, which most people probably will, then you can start getting prepped for your draw. So you want to...
Mommy,
yes, sweetheart. What happened? It's okay. No big deal, bug. Maybe we can fix it. Oh, well, okay. Maybe not. All right. So our lab wants 2. So I'm drawing the needle back to 2. Let's see, there's like heparin in there. See, it's like blue. Okay, so you're going to kind of wiggle it around and kind of get it all in the syringe. So then pull it back to 2. Okay. And then we're going to wipe with alcohol. Pat it up. Okay, then go wipe, wipe, wipe. Go 20 seconds in a circular motion. Sorry you broke it, bug. It's okay. I'm sure Chris can fix it. Go circular motion, go around, around. Okay, it's nice and prepped. Okay, there we go. You're going to put your gauze up here because you're going to want to get it. No, I don't know if I have blood in it.
No, it's fine.
I'm not sure how this thing works. We broke it. We break everything. Shouldn't let me in the hospital. I'm going to break everything. Break people. Okay, so now we're going to take the cap off. And you're going to make sure your bevel's up. See, let's see. You see the thing? Bevel. See that through the hole? Bevel. No bevel. So you want bevel side up. That's where the blood's going to go. Right? So hold it like you're having a pencil. Position the patient. You're going to have a towel underneath their wrists. They're going to be relaxed. They're going to be relaxed. Don't clench. Have them clench. Be relaxing. Clenching will make the tendons kind of occlude the artery. You don't want that. Find their pulse. Since we broke it, I don't have a pulse now. But we'll just pretend. Find the pulse with your hand. Use 2 fingers. When you find it, kind of visualize where it's going, because you're going to aim for it. You want to try to get it in like the path it is. Doesn't make any sense. You know what I'm trying to say. All right, so bevel side up. You want 45 degrees because you in there. Keep 1 finger up on. You can use 2, but keep 1 finger to steady it, right? Okay, so when you're in there, go in. You might hear a little resistance. That's the artery. And once you're in, you'll see blood, which we don't have, unfortunately. But you would have blood just start filling it up because it's the artery, it's pulsing, it's filling, it does all the work for you. So you would just hold it here until you have a full sample. Right? And then when you have a full sample, you grab the gauze and you would pull out the same angle you went in and then hold down. Hold down, stop the bleeding for 5 minutes, 3, 1, 3, however long it takes. Needle thing goes in this cool, where is it, red thing. We're not going to do it because then I can't use it anymore, but stick it in there and twist a little bit, and that's where the needle goes. But since, you know, oh, Band-Aid, put your Band-Aid on. But since we're not doing that, we're just going to unscrew it. Okay, so then after your quirky red thing, you put that in the sharps, then you would take this. This is the lid, see it? That goes on top. And then you kind of want to take your plunger and squeeze it up so the blood is all the way to the top, and that ensures there's no air bubbles in it, and kind of roll it around. That'll kind of mix the heparin up in it. And after you do that, you take your pre-made label that you made before, and you stick it on there, as so. Get your really cool biohazard bag, put it in there, and then get another bag and put it in there too, because you don't want to contaminate your sample. And take that to the lab. And then you clean up, and you tell your patient thank you, and you ask them if they want anything else. And you wash your hands, and go on your way. And that's it. Yep. Okay, bye.